Now, the whole idea of the Jefferson curl is to strengthen your lower back muscles by bending forward and returning back up to an upright position. I'm not exactly sure why it's called the Jefferson curl. If you happen to know, make sure you leave it in the comments. Whoever's comment gets the most likes, I'll be sure to shout you out in a future video. Bending our low back gets a ton of bad press when it comes to back injuries. Everybody talks about if you want to avoid back injuries, you should lift with your legs, don't bend your back. But research has shown and been very clear that it's critical to have a strong back to prevent back injuries, and your low back needs to be able to bend. We were made with a spine that has segments, and each segment is a joint. And if each segment can't move in a controlled fashion, you're destined to have some sort of problem. So what we're looking for when we work with patients is the ability to control both the spine as a unit without the segments bending, and to be able to control the spine as it flexes segmentally, or vertebrae by vertebrae. Now, before you would even get into this exercise, I'm going to need to see that you're able to demonstrate that straight leg deadlift without bending your back, that hip hinge. If you can't control that, then I'm not comfortable with you doing segmental flexion with resistance until you can show me that you can do that properly. Now, I've talked about it in prior videos, but again, to review, the hip hinge is where you're able to keep your back arch all the way through the movement. I'm starting with about 5% of my body weight here in each hand, so 10% total. And then I'm keeping a slight bend in my knees and flexing forward from the hips. And you notice my butt and hips go back. So if I have a target behind me, I'll reach back and try to touch that. And then when I initiate the movement upward, I'm trying to do that with my hamstrings and my glutes to start that movement. Any movement we do, we always want to start from the ground up. So I should feel like I'm driving, actually even down to the toes, start with my toes digging into the ground, my calves contracting, my hamstrings, my glutes, and my back. Once you can do the straight leg deadlifts for 1 to 2 weeks, using about 10% of your body weight in each hand, or 20% of your body weight if you're using a barbell, and going through 3 sets of 10, 2 to 3 times a week, then we know you're able to start on the Jefferson curl. Now, to start off the Jefferson curl, we're gonna have no weight at all. And we're gonna start flat on the ground and just seeing if you can bend your spine segment by segment. So starting with your head and then through your mid back, and then rounding through your low back, and then getting as much flexion as you can, and then your hips start to go. And then you wanna bring yourself back up from the bottom up. So now I'm starting with my hips. I squeeze my glutes first, and then I'm bringing my tailbone, and my pelvis starts to come up, and I bring up my thoracic spine and my cervical. At no point should you have any pain during the course of this exercise. In fact, you should completely avoid this exercise if you're currently dealing with a back issue that leads to any type of radiating symptoms into your legs, whether it's sciatica or you've been diagnosed with a herniated disc. You just want to make sure you're under professional care and able to move through the exercises safely. When you raise your surface off the floor, you definitely want to start with a flat step. I'm advancing to a slant board, which is going to put much more tension in my nervous system running up the back of my legs. So yes, it does stretch my calves and my hamstrings and makes them work in a more lengthened position. But where you need to really be careful is the fact that this is putting more tension into your nervous system. Many people have a lot of nerve tension up their tibial sciatic nerve into their low back, and this is going to make you much worse. So definitely don't start with a slant board. This would be your top level. But doing so is just going to allow you to get a little bit more flexion all the way down. And then bringing it back up. If you have the mobility in your hamstrings, and you can go all the way down, you go for it. But like I said, a lot more tension into the nervous system. So I would just try to get just beyond your toes to get the added benefit of the step. Okay, many people are too tight to even get beyond their mid shins. So there's no reason to start with an elevated surface until you feel like you're bottoming out with the dumbbells or the barbell on the ground. Clinical experience and research tells us that having a strong lower back, hamstrings, and glutes are critical for preventing low back pain. However, if you don't have adequate strength and you attempt to do this exercise, then you're going to be putting yourself in a position that tends to cause most lower back injuries. Many of the issues we see coming into our physical therapy centers are from lifting under load when you don't have control of your spine. There's lots of other factors that can contribute, like a lack of hip mobility. If I can't bend my hips past this degree, my back's gonna have to compensate by flexing further, and those muscles just simply aren't as strong. So the load that you lift is key to your progress. A simple hack to see if you're safely capable of lifting an object off of the floor without help is just to approach the object and try to push it with one leg. If you can move it, then you know that you're able to have a lift off of the floor without any difficulty, and you shouldn't need to have help. If you can't move that with one object, with one of your legs, then you know you probably need to get help before you try to lift it. Now, if any of these exercises or movements are too difficult for you and you want something to help you bridge the gap, I recommend working on strengthening the low back from the bottom up using reverse extensions. I have my Flybird adjustable bench here that I've picked up on Amazon. I have a link for one in the video description. I just pull the pin, I can drop this down, and I'm gonna hold the top of the bench. I put my hip bones right where the bench breaks, these pointy hip parts of your pelvis, and then I hold the top of the bench. And then from there, I want to just lock my low back by doing the arch, and I'm just lifting up from the bottom up. Trying to get extension through the back. Notice I'm not going real high. I'm just trying to get a little bit past neutral, straight line from shoulders to hips to knees, plus a few degrees. Start with 2 sets of 10, work yourself up to 3 sets, and then increase your repetitions as the weeks go on up to 15 and even 20 in a set. Should never have any pain if you do. So all in all, the Jefferson curl could potentially be a helpful exercise, but only if you're able to safely go through the precursor exercises I showed in this video. Because of the way our backs normally get injured, it can be a potentially dangerous exercise if you go into it without adequate strength and stability at each spinal segment, glutes, and hamstrings. If you have any more questions about the Jefferson curl or any other low back exercise, be sure to leave a comment below and I'll reply as quickly as possible. To watch more content to help you move your best, click down here. To subscribe to my channel and help me cut out unnecessary surgeries and opiate use by spreading the message that movement is at the root of all problems, click over here. If you want to keep improving, you got to keep it moving.